Hi, I'm Michael Sudbury of Myofascial Release of Salt Lake in Salt Lake City, Utah. Today, I'm going to show you a couple of things that you can do when you've got carpal tunnel syndrome, wrist pain, injury, stiffness, weakness, anything at all going on with your wrist. These things will help with multiple issues, multi-purpose, very effective. Take a look. One of the first things you can do with your wrist is to just stretch your palm, your whole palm, all your fingers. Stretch, open, reach with your fingers, lengthen. This is an excellent way to start getting a sense of what's caught, what's stuck. You might be able to see it, but this area has gone all white in my tissues. Here, I'll relax. Maybe that doesn't show up so well, but you'll probably notice, you'll feel where it's hard to reach, it's hard to open. This area is closed. Well, I'm pretty good, but it's a little bit shorter, and you can see that it's gone white right there. So you'll start seeing those things in your hand. If your hand can only open like this, you got some problems. Anyway, just simply stretching and reaching your palm like this can be a fantastic way to get things started. You're going to hold this for a few minutes. It really does make a difference. 10 seconds, 30 seconds, not going to make any permanent changes. So maybe while you're watching TV or, nothing better to do, just stretch your palm, hold that for a while. Just keep reaching. You can definitely see it now. White right there, right in there. And you'll notice that it gradually changes. Now, if you also extend that into your wrist and kind of reach perhaps like that, that'll start doing things as well. You can start going this direction. Just slowly play with it, and you could start adding in a little bit of a finger or thumb pull. You could start opening it this way. Just take your other hand and gently add some traction, a little bit of bend, a little bit of opening. Never force, never hard. Just see how that feels. And again, let that go for a few minutes. See, like right now when I did that, it's starting to kind of tickle and itch right in this section, kind of a peeling sort of a thing. And if I let that go on for a few minutes, at least 3 minutes, preferably longer, that will just start releasing the tissues, and I'm feeling it creak and everything in there right now. Always release, recover slowly. You can feel stiff, you can feel kind of sore afterwards, but some light, gentle movement, maybe like this, shake it out. That will help it feel better pretty quickly, and then you'll go, oh, this is feeling lighter and easier. Now, if you don't notice any of that at first, that's okay. Keep at it, the effects add up over time. That is another way you can go. Reach and traction. You can compress a little bit. You can take your other hand and squeeze these bones and push a little bit in, rotate a little bit, not using a whole lot of force, but I'm just experimenting. I'm moving around and I'm finding the places that twinge a little bit, hurt a little bit, feel stuck, don't move, and I just kind of squeeze into that real gently. You can also traction. Again, notice, not hard. I'll see people squeeze really hard and they'll be shaking like this. That's not what you want. Gentle, light, easy. Okay, so thanks for watching. I hope that information was helpful to you. Give it a try. Let me know how it works. Remember, never force the tissues. You want mild discomfort at the very most. It should feel good. It should feel helpful. If this wasn't enough to resolve your issue, give me a call. Check out my website. I'm sure I can help. Thanks.